I'm Dr. Deuk Laser, CEO and founder of the Deuk Spine Institute, board-certified neurosurgeon. I've been practicing neurosurgery for now 30 years. One of the types of procedures that is becoming more and more popular amongst patients is a procedure called DISCSEEL. DISCSEEL is a procedure that was FDA approved, and it is being performed on patients where they have a disc problem. The doctor will recommend the DISCSEEL. The patient will then go to the operating room and have a needle inserted in their back. The needle will then be used to inject the DISCSEEL product, which is supposed to eliminate back pain and seal the disc when there is an annular tear or disc bulge. And the problem is that in theory it sounds great, however, it doesn't work. At least in my experience, it's never worked. We have many patients who will try the DISCSEEL procedure at the recommendation of their pain management doctor. They get the DISCSEEL procedure done, but they still have the same pain afterwards and they get no relief. Those patients end up having to have additional procedures such as fusion or discectomy, laminectomy, or even the Deuk Laser Disc Repair, which is the best procedure for a disc problem. So in essence, they have the DISCSEEL procedure, they pay for it out of pocket, and the cost is not inconsequential. The DISCSEEL procedure costs range anywhere between $15,000 to $30,000, and it is usually a cash out-of-pocket expense by the patient because insurance companies typically do not pay for that procedure. So we had the opportunity to treat a patient recently who was here for endoscopic Deuk Laser Disc Repair, but prior to that procedure, they had had the DISCSEEL procedure done. And you can see here during the surgery on this patient, when we placed the endoscope into the disc and we were able to see inside the disc that was treated with DISCSEEL, the disc looked absolutely terrible. This is one of the worst looking inside of the disc I've ever seen, and I attribute that to the DISCSEEL procedure. You see all the scar tissue within the disc, and you can see hemorrhaging, you can see brown, necrotic, dead disc material and other material. There's sort of a horrible reaction by the disc to the DISCSEEL product that was injected into the disc. He's actually a patient from Georgia. He had the DISCSEEL procedure done in Georgia, but it did not work, so he contacted Deuk Spine Institute. He did the MRI review over the internet, and during that MRI review, I was able to make the diagnosis that his pain was coming from two discs. Both of them had previously been treated by the DISCSEEL procedure, according to the patient, and both of them had terrible looking inside the disc with all kinds of hemorrhagic and necrotic material that we removed during our Deuk Laser Disc Repair surgery. Now the patient is completely pain-free, happy, and on his way back to Georgia. Anyway, I wanted to share this with you. Please check out our podcast, check out some more of our videos, and our website at deukspine.com to learn more about the DISCSEEL procedure.